in terms of how we can do in the future to prevent better, detect earlier, and respond more effectively to emergencies. Those recommendations came from very important organizations like G20, G7, UN, WHO, our own committee. And it went up to 300 recommendations. And at some point, our Director General took those recommendations into consideration and rightfully said that it was necessary to make this a reality. He went on and proposed 10 very concrete action for the world to really get more ready for emergency preparedness and also for pandemic prevention. That also went to become also the HEPR, the Health Emergency Preparedness and Response document. And also there is another document like the Pandemic Readiness and Emergency Preparedness that were inspired by our Director General's call for better preparedness for the world. One of the key elements that came after that was a National Action Plan for Health for Security Toolkit that was developed by WHO and many partners. And I particularly want here to emphasize the role of Resolve to Save Life with their experience and their long network in the world contributed to the development of the toolkit for the National Action Plan for Health Security, but also the contribution of member states, the contribution of individual people who had experience and who help us develop that National Action Plan for Health Security toolkit. A toolkit is just what you do from it. Now we want to launch that toolkit and accompany our member state to develop a better National Action Plan for Health Security, because all the evaluation we are doing, the experience we are doing, are only useful if it is implemented in the field. And the only way also to implement the thing on the best way is to plan for it. So I stand here today to reaffirm our commitment to supporting member states in their journey toward enhancing health emergency preparedness. We invite and encourage all nations in the Africa region to utilize this invaluable toolkit. It offers a wealth of knowledge, best practice, and practical guidance that will enable countries to strengthen their health system and respond effectively to future emergencies. Together, let us embrace this new chapter of emergency preparedness in the Africa region. By aligning our effort with the global framework for strengthening preparedness, leveraging the power of our regional flagship also, the pros, which is just all the tools and all the things we are offering to our member state in order to be better prepared. We can build a stronger, more resilient future for the people we serve. Thank you all for unwavering commitment and support. Together, we can ensure the health and well-being of our community in the face of any health emergency that may rise. And I do believe that Africa can lead the world in terms of better preparedness, because we have a lot to do and we have a lot of experience and a lot also to share. Thank you very much.
Thank you very much, Dr. Salam. Now we are going to move to the next remarks by the Vice President of Resolve, Amanda. Welcome, Amanda.
Thank you so much, Dr. Mary and Dr. Salam. And it's a real pleasure to be here on behalf of Resolve to Save Lives as part of our collaboration and ongoing commitment to support WHO and the member states accelerate implementation of their health security plans. This toolkit represents the learning of many years and engagement with member states and WHO to really support countries to accelerate the implementation of their national action plans for health security. The NAPHS provides an opportunity for countries to unlock and maintain investments in preparedness. It's complex programming that covers more than 19 technical areas and at times can be more than 500 activities long. This toolkit recognizes health security as a complex system and helps provide tools and ways of working that can help countries set priorities and agendas to routinely and effectively implement their priority actions to address key gaps and barriers that stand in the way of their preparedness capacities. We have a number of assessment tools, and these are critically important. The IHR State Party Assessment Annual Report and the Joint External Evaluation provide a foundation for us to understand where our key gaps are, but it's not enough. Countries must ensure that they have well-prioritized plans in place to strengthen their epidemic preparedness and their capabilities. Using this toolkit to develop well-prioritized NAPS requires synergizing technical and organizational capabilities, which need to be achieved by synthesizing those outcomes and recommendations from the many assessments, including the after-action reviews, the interaction reviews, the risk assessments like the STAR and the VRAM tools, as well as the PVS and One Health tools. It's a lot of different information sources and assessment tools. This toolkit provides ways of synthesizing those assessments, helping us prioritize those key actions, tracking the implementation and measuring our performance in the goal of achieving implementation of the NAPS for stronger systems to be able to protect countries, communities, and individuals. The NAPS toolkit was designed with the help of countries to effectively and efficiently develop these tools, and with support from a number of partners, really focus on connecting planning, financing, and implementation. It's with that focus on getting to implementation and strengthening systems that Resolve remains committed to supporting member states and the WHO, not just implement this toolkit, but implement their plans and achieve success in health security to make sure that Africa is a safer and more healthy place to live for all. With that, thank you so much. Resolve remains committed to supporting the implementation and look forward to the next steps with WHO and member states.
Thank you very much, Amanda. And now we are moving to the overview of the NAPS toolkit, which will be taken by Roland Wango, who is the focal point for NAPS in the region. Welcome, Roland.
Thank you very much, Mary. I feel like Amanda has done quite a good job leading into this overview presentation with her opening remarks. So I'm going to take you through what the toolkit looks like and what it does. So I'm hoping you are seeing my screen. And if any of you has not been in any of the bubbles that you see here, or currently not in any of them, then you're probably in the wrong place right now. Or we are looking to bring you into one of these bubbles, whether it's CIMEX, quality improvement, VRAM, some team or another after action review. Please, all of these things are familiar to us, and it's because of all of these bubbles that we have the toolkit. So if we are looking at our toolkit, we're going to be trying to see how we use the toolkit to simplify and accelerate NAPS implementation. Dr. Salam said equally at the beginning, we had identified challenges in the implementation of the NAPS that we developed post the JEs that we did 5-6 years ago, depending on which country you come from. All the delays were from getting our assessment results into a plan that will enable us improve the scores that we observed, the quality and feasibility of the plans that were developed. We had opportunities that we didn't seize in order to incorporate into IMF, the IHR monitoring and evaluation framework approaches. We had limited implementation and monitoring of these NAPS. There was poor coordination and alignment between partners working in different countries, with each coming with separate agendas and difficulties in coordinating our interventions. And of course, some fundings were available, but not properly allocated, and accountability was also an issue. So with the NAPS toolkit, what we are trying to do is that we have this document that AFRO has validated in 2021, and 7 of our countries have used all or part of this toolkit. We have also used the toolkit in a workshop that we conducted in 2022 in Zambia, and 22 countries took part in this workshop, and this document was exposed to these countries. Now, coming from all of these experiences, Resolve to Save Life and AFRO took the lessons, and we've improved on this document. And I'm calling it the document because we're looking at a document, but actually it's a toolkit, and we're going to see all the tools that are inside. So the partnerships, we stated AFRO, WHO, Geneva, US CDC. We have NAPS centers that set the stage in various countries for health security capacity development. And we are basing our toolkit on the assessments, the development, and the implementation. So we are still using the various steps that we had in the NAPS development, but now we are taking the tools and putting them within reach in this toolkit. So you'll be going through the NAPS 3 steps, the assessment, the development, and the implementation, but not just reading a document, which is the guidance, but now having tools within your fingertips to implement what the guidance is providing for us. So the toolkit has these 3 principles, and these 3 principles also guide various activities we do at WHO and with our partners. We are looking for good governance systems that work in a timely manner, and of course, continuous quality improvement. So if we're looking at our support dedicated to preparedness teams, the toolkit provides for NAPS coordination team. This is a group of stakeholders at the level of the country that are dedicated to oversee and coordinate the NAPS process and the collaboration between relevant sectors and all the technical areas. We're also looking at the technical group of governing and focal points. These are involved in the operations from each technical area, and they support the NAPS coordination team by providing technical and operational inputs. Then we have the decision makers, our supervisors, senior management, leadership, depending on where we are, the various public health institutions that we have in our countries. This is to ensure buy-in and ownership. And we saw in a previous slide that this was a challenge as well, getting governments to own the document and as such provide for technical and financial support for its implementation. These dedicated preparedness teams, we are looking at core competencies, program management, leadership, communication, and negotiation. This dedicated team will have monitoring and evaluation capabilities. We have a One Health approach, meaning that all sectors that are involved in the implementation of the IHR and the improvement of health security should be implicated within the dedicated preparedness teams. We have epidemiologists, surveillance experts, and of course, legal and advocacy minds. These are very important to drive the principles and guide us within the context of the existing legal frameworks within each country, and use the available advocacy channels in order to promote the NAPS and mobilize resources. Our social systems, naming the NAPS as a cyclic interconnected process. Here again, we see this cycle. We assess, we develop, we implement. This is the IHR system strengthening cycle. This is embedded in good governance and accountability, without which it will be difficult to do any of the three aspects of the assessments, the development, and the implementation. If we are looking into the toolkit, we'll get to see that we also have various chapters. If we are in the assess chapter, we have a flow chart that determines what we are doing, noting that we have timelines for doing each of the steps that we have in the assess and prepare, or the develop, or the implement and monitor. So we give ourselves timelines because, again, as Amanda said, we are combining here technical expertise for various domains, including organizational management and project management. All of these skills are provided for in the NAPS toolkit and means of developing such skills wherever there is a lack thereof. If we're looking at our third aspect here, we are supporting quality planning informed by implementation data, and then the IHR monitoring and evaluation framework assessments, and of course, the benchmark tool. Somebody said, Stephen Covey, if you have too many top priorities, you effectively have no top priority. This is why one of the major things we do during the development and even during the assessments is prioritization of our actions or lessons learned.
De l'évaluation et de la priorisation des actions.
Processo de planificação. E esta priorização deve poder nos dar 2 a 3.
What we are looking for here, if we are looking at our assessments and lessons learned from implementation, which we get from our monitoring, and we have a reference document, the benchmark, we should be able to identify some key priorities that we put into our national action plan. This toolkit will also make a difference between what we'll call a strategic plan for over the 5 years and operational planning, which will be for a year or 2. So that should be taken into consideration, and the tool provides for extensive explanation, the difference between the two, and how to go about developing these. So if we're looking at an example here, national legislation, policy and financing, and which if we're looking at our new version of our JEE here, we're going to be looking at that these have been split into national legislation and then financing, and we have advocacy as well. So don't get confused. We are still talking about the same planning process, but using that example. So if we're looking at steps 1, 2, 3, we are compiling and reviewing reference data. And this compilation and assessment will help us to identify potential action and inform their prioritization. Most of us on the call have gone through this process. So this is an example. Before would tell you to do a prioritization. Right now, you'll be able to look at previous NAPS implementation progress, because within the toolkit, we have a tool that provides you with an opportunity to regularly monitor your NAPS implementation as often as you want, so that if you need information for planning purposes, you'll be able to have that information at your fingertips with the tools that are available to you. So we'll have an indicator. Primarily in AFRO, we use our JA indicators and the objectives. We have a strategic action that emanates from one of the assessments, and that's developed by us and the team that is within the country. We have identified during an assessment how much of that strategic action we've already achieved. In this case, we're seeing 75% for the first 3, and then for the last 2, we've not started. So we get into the other sections of the table where we're identifying best practices, and we're also looking at the challenges, and then we identify recommendations. This all happens when we are doing our monitoring or an assessment, midterm, end term, or quarterly of our implementation of the NAPS. Based on these recommendations, we have reference IHR assessment, and we have risks or events that we evaluated. These are circumstances that might have provided challenges as to the implementation. So if we go to another, we're looking at a review of benchmark actions to achieve the target JEE SPAR scores. So here we have our indicator, and the indicators are not changing because we are going through the indicators that we have in the JEE or SPAR. So our most recent assessment score will be showing, and then we'll have an option to set ourselves targets for end of year or end of period, whatever that period will represent, a strategic period or an operational period. We'll determine actions that will be required to achieve our targets for the set period. So such tables will be available within the toolkit for us to use during the various stages of assessment, development, or implementation of our NAPS. Looking at steps 4 through 5, we have prioritization of actions and then a draft of our detailed activities. This references various slides, and there's consensus building to select the priority actions. Again, we are talking about 2 to 3. Remember, we could have as many as we want because it depends on how much challenges we identify during the assessments. However, depending on the period we are developing our plan for, we should be able to reduce our priorities in order to focus our interventions over a period of time. In order to do the identification of potential actions and prioritization, we are looking at impact and feasibility metrics. This is here a 4x4 matrix. And mind you, there could be many ways of doing prioritization. We are providing you with a highly recommended method here that will facilitate your planning and improve upon the time it takes for you to develop, be it your strategic plan or your operational plan. So we are looking at the impact. We take a strategic action, we're looking at its impact, its feasibility, and then it's going to give us a prioritization category. And after that prioritization category, we should be able to have our major projects, high, low. This is B category. A is a low-hanging fruit, something we could achieve really quickly with the means already available. We have low, which are tasks that we can put for later, and then we have really a low, high, and we can consider eliminating. So there are some things that we consider eliminating for the time being. We are not eliminating because they are no longer a challenge, because we have identified them as a challenge. It's just that we are keeping them for a later part, or for another year, or for another strategic planning phase. So the eliminating here is just keeping it out of the current planning cycle, but not eliminating the challenge. If we are finalizing our actions and drafting activities, we should have had our strategic actions, the 2 or 3 strategic actions emanating from the prioritization exercise. It is for those actions that we'll be developing detailed NAPS activities. In the past, we've been having many strategic actions and struggling with detailed activities and having hundreds of activities within our plan, and the budget just becomes so large, it's difficult to read the final figure. What we are trying to do with this toolkit and with the current NAPS guidance is help ourselves with biteable sizes of implementation plans, be it operational or strategic. So if we're looking at where we are now, we are at point number 4, which is the synergy and alleviation of redundancies. We are struggling with functional groups, technical areas organized as functional groups. We can have the functional groups according to the JE pillars: prevent, detect, respond, and then points of entry and other IHR hazards. Or we can go through our health emergency, the HEPR 5 Cs, and take functional groups according to the emergency coordination, collaborative surveillance, community protection, clinical care, and access to countermeasures. Whichever way we develop our functional groups, we have complete guidance for various options, and we should be able to identify ourselves within the JE pillar, the SPAR, the HEPR 5 Cs. We know that the technical areas are interconnected in so many ways, and we've developed heat maps over time to see this interconnection, and those will be shared with you during the technical assistance that we'll be providing to each of your countries when that time comes. So what we're looking for here are common issues, anticipated collaboration, 5 Cs, themes that will bring us into grouping ourselves to better operate within the countries. So we're looking here at a NAPS implementation monitoring, and we're looking at bottleneck analysis approaches. And this is our 5th point here. This image you would see is part of the toolkit, and you get to see some of it when you start to use the toolkit, what we are calling the bottleneck analysis. It helps us identify what challenges that we're facing in the implementation and monitoring of the NAPS that we've developed. If we're looking at our next steps here, is that we've finished the discussions in Nairobi. We've done all of that. We've launched this official, guidance, and we are at this instance here where we are presenting the tool to all of you and rolling it out for use. Those who have used it before, you'll be able to get a final version based on your recommendations and experiences, and we should be able to use this tool. So going forward, following this webinar, we're going to send out the final version once it's published, with the link to all the tools, with the link to the NAPS guidance and every other thing that's associated to improve our quality for assessments, development and implementation, and of course, monitoring of the implementation of the NAPS. Thank you very much for your attention.
Thank you very much, Roland, for that a great presentation. Thanks to you and Resolve to Save Life team for the good work on NAPS. It's now time to ask your questions. I've not seen any question on the Q&A. Again, you can type your question on the toolkit or NAPS on the Q&A, but you could also raise your hand. So to raise your hand, if you go to the bottom of your screen, you will see reactions. If you click on it, you will see a button where you can raise your hand. So it's time for question and answers now.
Mary, there's one question from Dan Stoll from USCDC on when the interim guidance can be accessed, when and how.
Okay. Roland, do you want to respond?
So this interim guidance and the toolkit, what we are doing right now is finalizing with a publication team to harmonize the feel and look of their tool on the web. We have the document, but we need to put all of this together. So we are hoping and working hard with the publication team so that we have this running within this third quarter. We know that a lot of you are already going into JEEs and have done assessments of your previous NAPS, and you're in different stages. So we are trying to make this tool available to you before you begin any other planning going forward. So as soon as we have concrete information, we'll share with all of you an exact time. But for now, I don't have an exact timeline, but within the current quarter, we should be able to have this sent out to you. Thanks.
Thank you. Vivian, do you want to take the French question?
Yes, we have some questions here, but are still in English. A question from Kola Jinadu. Is there any second layer of prioritization if a lot of activity fall in the category of high level? That should be category A. Thank you.
Okay. Roland?
So a second category of prioritization of strategic actions. Remember, we have two sets here. We have strategic actions to which we've tried to, the aim is to limit ourselves to 2 to 3. And then for each strategic actions, we should have a set of activities. What we are hoping is that we would be realistic in the detailed activities. We might have a long list, but we should be able to get to a point where they are realizable activities within the time frame of the planning. What I'm trying to say here is that we should be able to have, if you're doing an operational plan, you have 1 year, you will be realistic enough to know if I put all of these activities, I might not be able to achieve within this year, and I'm going to keep this set for another planning cycle. So, and otherwise, there is no limit to the number of prioritizations you can do, as long as you're respecting the principle that we have provided within the toolkit for prioritization. The same principles you use for your strategic actions could be used for your detailed activities, and all of that only improves your planning process. Thanks.
Thank you, Roland. Dr. Salam, you have your hand up.
Yeah, thank you very much. I just will ask a question in behalf of our leadership that definitely would ask that question. How this toolkit will guarantee that the NAPS will lead to a health system that is resilient and also sustainable?
This is an interesting question. Over to you, Roland.
So one of the things that we're looking at, the NAPS implementation itself is based on those 3 aspects we're talking about: governance, quality, improvement. We know that if we get good quality assessments and we're looking at a toolkit that provides us with the tools, all the tools we need to develop a quality plan based on quality assessments, the implementation of that plan would be guaranteed better, because in the past we've not had opportunities to have all the tools available to us at a few clicks away. The only other aspect will be the implementation resources, human resources and financial resources dedicated for this implementation. If we're also looking at the implication of the government developing these functional groups, having NAPS, dedicated NAPS teams for the implementation and monitoring of its implementation, linked to the various indicators that we have from the JE, from the SPAR, these all contribute to improving health systems and resilience. So this is something that we are going to definitely keep an eye on, and with consistent monitoring, contribute to that improvement. Mary?
Thank you, Roland. Liz?
Mary, sorry, before we move on, can I just build on what Roland said as well about the toolkit? One thing that the toolkit pays special attention to and offers special guidance to is the involvement of and taking a multi-sectoral coordination approach. So looking beyond just the typical 19 technical areas, but thinking through strategically how to involve and engage stakeholders from a long-term standpoint to help contribute to the sustainable improvement of these systems together. So just wanted to flag that as well. Sorry for the interruption.
Thank you, Julie. That's very useful addition. Lizzie, can you ask your question, please? Lizzie, can you ask your question? Okay, while she's getting ready, Vivian, back to you with the questions in the Q&A.
Thank you, Dr. Mary. In the Q&A, I have 2 more questions in English and 1 in French. I'll start with the French question from Mamadou Ouri. Mamadou Ouri says, en Guinée, nous avons fini la JEE et nous voulons procéder à l'évaluation du PANS passé et écrire un nouveau. Quels sont les éléments à prendre en compte, le JEE ou l'évaluation du PANS? This is a question in French. I will now look at the question in English. From Salomon Nirea, thank you for the presentation. My question is, the guide is implementing impact and feasibility for prioritization, but could it effectively help in prioritizing action area? Recently, we had used WHO benchmark 717 after action review and so on, and had helped to identify timely and practical gaps and prioritize accordingly. The second question is from Flavia Semendo from WCO Cabo Verde. Is it possible to use the tools to assess and update the NAPS already developed? Yeah, thank you. Those are the 3 questions.
So let me take these 3.
Hold on.
Okay.
Fakir, get ready with the Portuguese question. I can see a question in Portuguese. So you answer the first question in French language, and the 2 in English, please. Thank you.
Yes. So pour la Guinée, Ouri, oui, on vient de finir votre évaluation. Il y a l'évaluation du PANS et l'évaluation de la mise en œuvre du RSI. Il faut savoir que les deux ils sont compatibles. Vu qu'on a déjà fait une évaluation externe conjointe, on peut se baser sur cela pour améliorer le PANS que vous avez déjà en Guinée. Le toolkit que nous avons démontré a des outils pour nous permettre d'évaluer le PANS, mais également intégrer les recommandations de la mise en œuvre de l'évaluation externe conjointe pour améliorer un PANS stratégique pour les 5 prochaines années. Donc, ce n'est pas inutile. Les deux sont compatibles. For Solomon's question, I would say that there's all of these aspects you've named the benchmark, the 717, the after action review, simulation exercises, and all of that. They provide those assessments, right? We use those for assessments, and we get recommendations from those assessments to develop the NAPS. What we are talking about prioritization here is based on those assessments and those recommendations. We are using the NAPS toolkit to develop plans from those recommendations, and that toolkit gives us an opportunity to do prioritization of the recommendations, prioritizations of strategic actions, as well as prioritization of the detailed activities. Going to the question from Flava, yes, we have a monitoring tool within that toolkit that you can use for monitoring the current implementation of your NAPS if it's still current. So there are tools in there that we can use, and it's going to provide us with a way forward for the next iteration of an operational plan or of another NAPS. What you, in your case for Cabo Verde, you don't need another NAPS. What you'll be doing is using the operational planning tool in the toolkit, following the NAPS assessment to have operational plan for the next year or two, depending on the situation in Cabo Verde. Mary?
Thank you, Roland. Fakir, can you take the question in Portuguese, please? There was a question from Guinea-Bissau.
Yes, good afternoon, colleagues. The question is from Guinea-Bissau is saying that it doesn't know where are they in terms of NAPS. This question is directed to Dr. Wango.
Yes, Bakar. So we have the NAPS of Guinea-Bissau. We've completed that NAPS and it's been submitted to the authorities. So what you guys are supposed to be doing is determining when to do an assessment of your NAPS, because we need to, it's already been a year. We might want to have some form of a review so that we can develop an operational plan. And we have a toolkit, a tool within that toolkit to assist you with that exercise. If you need technical assistance from AFRO, please do not hesitate. We're going to provide you with a team to support that assessment of your NAPS implementation.
Yeah, Vivian, more questions? Yes, so if you have any question, requests, feel free to reach out to AFRO. You will
thank you.
The needed support. Yes.
Thank you, Dr. Mary. In the chat, we have 3 more questions. The first one is from Wilfrido Gil. Thank you for your presentation. My question is regarding prioritization. Is it prioritization, is it for each year or for the 5-year time period? And the second question will be in French. Comment AFRO compte soutenir les bureaux pays pour qu'ils puissent confortablement soutenir le processus de développement des PANS dans les pays les plus rapidement et réduire les délais entre les JEE et les PANS? C'est la question de Serge Akbo. Et il y a, there is another question in English from Luis Corrales. Can you provide access to the draft documentation? We at the World Bank are in the process of preparation of a regional pandemic preparedness and response regional program for West and Central Africa, fully integrating the One Health approach. The NAPS is a key source for identifying key interventions to be financed by the World Bank Group. Having that information would be of great help. Thank you. Back to you, Roland.
Okay, thank you, Vivian. Hold on, Roland. Let's take Dr. Savannah, the live question, and then you can take them. Julie, feel free to jump in if you want to complement any of the answers, please. Dr. Savannah, please. Yakuba Savannah.
Oui.
Savannah, allez-y, vous avez la parole.
OK, merci beaucoup. Bonjour à toutes et à tous. À la suite de la question posée par Dr. Bad de l'OMS Guinée, j'ai bien compris les éléments de réponse apportés par Dr. Roland. Il s'agit bien de l'évaluation du PAMS en Guinée à la suite de l'évaluation externe conjointe que nous venons de conduire. Donc, on a compris par là que les deux sont compatibles. La question que je voudrais poser, donc, est de savoir quelles sont les étapes à suivre et l'accompagnement que l'OMS voudrait bien apporter à la Guinée dans ce processus. Merci à vous.
Merci. Over to you, Roland.
Vivian, you might have to come back to some of those questions, but I'm going to start with Savané. Dr. Savané, en fait, le processus, on a déjà fini votre évaluation. Votre rapport est en cours de publication. On l'a soumis au secrétariat à Genève. Les prochaines étapes, c'est quoi? On doit identifier un cadre, un moment pour pouvoir élaborer, je dis élaborer, mais en fait, mettre à jour votre PANS. On doit avoir un plan stratégique et développer un plan opérationnel pour une année ou sur 24 mois. Donc, voilà essentiellement les étapes. Nous restons disponibles, vous le savez très bien, à apporter l'appui à la Guinée pour que nous puissions avoir un PANS qui est valable pour la Guinée avec un plan opérationnel à l'appui. Serge, par rapport à votre question, il est question, après ce lancement, pour nous, n'est-ce pas, de faciliter une orientation de nos collègues au niveau du bureau pays avec, sous l'outil, une orientation beaucoup plus détaillée que cette présentation. Ici, nous faisons un lancement, on a fait un aperçu. On va organiser d'autres opportunités avec le collègue du bureau pays, avec les points focaux nationaux, avec les partenaires, en détail et voir le contenu essentiel détaillé de cet outil pour que chacun ait la capacité de pouvoir utiliser, n'est-ce pas, cette boîte à outils pour pouvoir mettre en œuvre différents aspects dans le processus de développement et de mise en œuvre du PANS. Donc, il est prévu des formations et des orientations des différentes équipes à différents moments. Vivian, can you get back to the two other questions in English?
Yeah,
please?
hold on. Let's take Dr. Manjang from Gandhi, Gambia, and then she can read out the other questions. Dr. Manjang?
You hear me?
Yes, we can hear
thank
you.
you very
Go
much.
ahead.
We completed the NAPS in the Gambia in 2021. So we also did the remap in 2022. So we want to launch the NAPS. So I'm just asking as to what might be the timeline for the launching of the NAPS, because that's the only activity left with us to complete the process. Over to you. Thank you.
Thank you, Dr. Manjang. Vivian, you can add more questions for Roland to take.
Yes, please. I can see that Julie is also answering to other questions directly in the chat. So I'll just take the question that she has not addressed. The one from Luis Corrales. Can you please can you provide access to the draft documentation? We at the World Bank are in the process of preparation of a regional pandemic preparedness and response regional program for West and Central Africa, fully integrating the One Health approach. The NAPS is a key source for identifying key interventions to be financed by the World Bank. Having that information would be of great help. Thanks. The other question is in French. Le Congo, the question is from Jugel Ganongo. Le Congo a fait l'évaluation à mi-parcours de son PANS et dispose d'un plan opérationnel en cours de mise en œuvre. Pouvons-nous utiliser cette boîte à outils pour évaluer le plan opérationnel? Roland, please.
Roland?
Oui, je commence avec le Congo. Nous avons utilisé déjà ces outils au Congo. Quand on a fait l'évaluation à mi-parcours du PANS du Congo, c'est l'un des outils dans cette boîte à outils que nous avons utilisé. Donc, le Congo a fait déjà l'expérience de cette boîte à outils. Il y a d'autres qu'on va utiliser au fur et à mesure que nous allons évoluer. Quand nous allons vouloir revoir, mettre à jour le PANS dans son intégralité ou bien développer un autre plan opérationnel. Donc, nous avons déjà utilisé des outils dans cette boîte à outils. Yes, we understand clearly that our partners need to know information. We are available to provide you with any information that is relevant to the partnership WHO has with all of its partners. So what I'll suggest here is that we'll put Mary, your email in the chat and mine, so that those with specific questions requesting for documentation should be able to send us an email, and then we'll share information that's available to us or any further clarification and documentation as well. So that's definitely something we can do. Dr. Manjang, yes, Gambia is ready to launch its NAPS. The launching of the NAPS is totally a country-owned process. You make up a date, set up yourselves, and if you need for us to show up and be part of it as guests or as facilitators, presenters, WHO, or any of its partners, please let us know. But it is your prerogative. Choose a date, let us know when it's happening early enough so that we can identify those of our senior management that can be part of such a launching ceremony. We've done for other countries before, and it's usually an opportunity for mobilization of resources and advocacy and buying. So every opportunity counts. Let's not miss an opportunity here. Come up with a calendar and let us know when and how we can support the Gambia for the launching. Mary?
Thank you, Roland. So I would like someone to write my email and Roland's email, please, for people that would like to send requests for the tool as well as other support so that they can write to us. I would like to call on our friend from US CDC, Richard Garfield. Richard?
Hello.
Good to see you.
Yeah, after a few days that I didn't see you.
Yeah.
I'm very happy to hear all of this discussion. We at CDC are very supportive with many countries, and in fact, will be more supportive this year. Many of our country offices will be engaged more in supporting countries than they have in the past. I want to stress for you that yes, you can certainly use your existing National Action Plan, but I think of the National Action Plans that exist mainly as a spiritual guide or a light at the end of the tunnel. It's an idea of where we hope to be in 5 years. That's helpful to have, but it doesn't tell you what to do today, and it doesn't tell you what to do 6 months from now. So prioritization, as you've been discussing, helps to narrow the field, but it will not answer all the questions, and it will not guarantee anything. The guarantees depend on 3 things, I think. 1, that an activity has an individual who's responsible for it. 2, that there is measurable activity to monitor how it's going. And 3, that there is a plan for when you will look to see how it's going so that you could correct it or modify it or see that it's going well. If you have those 3 things, I think you have a plan. If not, you have a brainstorm list of activities you'd like to have somebody do, but you don't know who, when, or how. And finally, I want to say from my own experience, there's not one correct, perfect list of what to do. It involves choices. Choices means we're going to do this now, we'll do something else later. And there's not one right answer. Whatever you're going to really do will set you toward your progress, and then you'll know what to do next after that. So choose the things that are important, but choose the things you're really going to do and have somebody in charge and somebody monitoring it, and make it short enough so that you can actually do, because 3 things that you really do will move your system forward much more than 15 or 20 that you would sort of a little bit like and maybe do. I think in general, Africa is moving forward more than any other region in the world on implementing the activities for global health security. And I admire and I celebrate this discussion today and your work in your countries. Thank you.
Thank you, Richard. We are happy to have you on the call today. Yes, prioritization is key. We've been talking about it. Prioritize, prioritize, and prioritize, monitor implementation of your NAPS. Okay, Vivian, any last question and then we close?
Yes, the remaining questions are around the availability and the access to the toolkit. So I think,
Okay,
yeah.
send us an email. Our email is on the chat, myself and Roland, and you will have the toolkits. Okay, on that note, if we don't have any other burning questions, I would like to thank all of you for coming for this launching. Let's make use of the available tools to strengthen the way we plan and implement the National Action Plan for Health Security. And WHO AFRO is always here to support. You can reach out to us by email on anything regarding health emergencies, preparedness and response, including the NAPS, and we are happy to support you. So thank you so much and have a nice evening. And for those that are on the other side of the world, have a nice afternoon and nice night for just joining from Asia. Thank you and have a nice day.
Thank you, everyone. Bye-bye.
Bye.
Thank you, everyone. Goodbye.